What is the role of shared decision-making in the treatment of musculoskeletal pain? In modern healthcare, there's been a significant shift from a paternalistic model, where decisions are solely made by healthcare professionals, towards shared decision-making, SDM. This approach actively involves the patient in choosing their treatment plan for musculoskeletal pain. SDM plays an important role for chronic conditions where there are multiple valid treatment options with varying benefits, risks, and impacts on a patient's life. It recognizes the patient's unique values, preferences, and lifestyle as vital components in determining the most appropriate and acceptable course of action. Research on shared decision-making in musculoskeletal disorders is limited. However, recommendations based on research from other health specialty fields can be extrapolated. What evidence supports the use of shared decision-making? 1. Better consequences. Studies show that patients involved in SDM gained more knowledge on their situation, experienced reduced decisional conflict, and reported positively influenced patient satisfaction. 2. Enhanced adherence to treatment. When patients actively participate in choosing their treatment, they are more likely to understand and commit to the management plans, such as exercise programs or lifestyle changes. And 3. Reduced healthcare costs and unnecessary procedures. SDM can lead to more patient-aligned treatment choices, potentially reducing the uptake of invasive procedures. How to promote shared decision-making in patients. 1. Elicit patient values and preferences. Recognize that patients' personal circumstances, beliefs, fears, and priorities are central to decision-making. For example, they may prefer to avoid surgery, need quick pain relief for work, or consider specific hobbies important. Explicitly ask, "What matters most to you?" or "What are your biggest concerns regarding these options?" 2. Provide balanced, understandable information. Present all viable treatment options, including watchful waiting, in a clear, unbiased, and jargon-free manner. Explain the pros and cons of each, including potential benefits, risks, side effects, costs, and time commitments. Use visual aids or decision aids where available to help patients appraise complex information. 3. Check for understanding and address misconceptions. Actively listen to the patient's interpretation of the information. Ask open-ended questions like, "What are your thoughts on what we've discussed?" or "What part of this remains unclear?" Correct any misunderstandings gently and reinforce key messages. And 4. Support deliberation and non-coercion. Give patients adequate time to think and discuss options with family or trusted individuals. Avoid pressuring them towards a particular choice. Emphasize that there is no single right answer, but rather the best decision for them. Your role is to guide and inform, not to dictate. Let's put it in practice. Dr. Chen is discussing treatment options for chronic knee pain with Sarah, a 45-year-old woman who has early-stage osteoarthritis and has tried painkillers with very little pain relief.
Sarah, your knee pain is still limiting you. We have a few good paths forward, and I want us to decide together which one fits best for you.
Okay, Dr. Chen, what are my options? I really want to get back to my evening walks.
Based on your progress, we have two main ways forward. Option 1, more focused physical therapy. It's non-invasive, builds strength long-term, but takes consistent effort and might be slower. Option 2, a supervised self-management strategy using an online program. This offers tools and guidance you can use at home with regular check-ins from our therapy team. It's flexible and empowering, but it still requires consistent engagement from your side. What's most important to you right now? The hands-on therapy or a more self-directed yet supportive approach?
I want to avoid surgery, and I don't want to just mask the pain. I need long-term strength, but the pain makes exercising hard.
That's helpful. So, long-term strength is key. How about we combine elements, for example, starting with the in-person therapy, then transitioning to an online program for its flexibility and guidance as your pain improves?
Combining sounds interesting. I do like the idea of having tools at home and checking in. If the online program can help me manage the pain enough, I think I could do without in-person appointments.
Excellent. So, our plan, we'll start you with a specific, supervised self-management program. Our therapy team will check in weekly to guide you. We'll reassess in 4 weeks to see how your pain and activity levels are, and then decide if it's time to transition to online physical therapy. How does that sound as our shared plan?
Yes, Dr. Chen, that makes perfect sense. I feel good about this decision now that I understand it.
To sum up, empowering patients through shared decision-making is vital for effective pain management. By actively involving them in choosing treatment plans, including digital self-management strategies, healthcare professionals foster engagement and improve outcomes. This collaborative approach respects patient values, builds trust, and ultimately leads to more personalized and successful care journeys.